Medical professionals of Reddit, what is the craziest DIY treatment you've seen a patient attempt? Had a patient come into the OR with a makeshift bandage on his shin. He had fallen on rocks while hiking and left a 3-inch long, half-inch deep gash in his leg. I go to pull the bandage off, and as I'm peeling it away I notice the skin is completely black and there's dark chunks of fungus falling out of the wound. It looked necrotic, like it had been left alone for a week. I look at this guy like he's crazy as he tells me the wound is only a few hours old. He's pretty proud as he explains that he created a makeshift poultice by chewing up leaves and moss, mixing it with river mud and stuffing it into his leg. That's what all the black mossy stuff was. Hint, don't do this. Finally, something I can add to. When I was in med school on my family medicine rotation, I was sent in to see a middle-aged woman with complaints of sinus congestion. Sure enough, from the beginning I can tell she's really stopped up with her nasally voice, and my history and exam are consistent with your run-of-the-mill viral upper respiratory infection. I begin educating her on symptomatic management and the following exchange ensues. Patient: do you think it might be the flu? Me: it's possible but unlikely. It's really out of the typical season. It was June. Patient: yeah, I guess I wasn't sure it was. I've been spraying Lysol everywhere and it doesn't seem to be doing any good, and it says it kills the flu virus. Me: well, that's something that could help disinfect the house and keep the virus from spreading. Patient: I guess. I just wish it didn't burn so much. Me: what do you mean, it burns? Patient: you know, when I spray it up my nose it burns so bad. Yep. My patient thought that since Lysol kills influenza, the best way to nip it in the bud was to flush her sinuses with it like a saline spray. It did not work. For the record, the fact that I didn't immediately fall over laughing and instead seriously counseled her against ever doing that again is still the greatest featuring of composure in my entire career. TL. Doctor, when the label on Lysol says not for internal use, they mean it. Not for internal use. Now it says that. It was marketed as a douche and birth control in the 1920s. Parents sneaking essential oils onto their premature baby's skin. They have central lines. These oils can wick onto the line and damage the line, cause infection, or interfere with medications. Infections in preemies can mean death within hours. Preemies have incomplete skin with much faster absorption rates than fully developed adult skin. These oils can cause burns and damage their insides. Your pyramid scheme company is not a reliable source for neonatology treatments. Please, dear God, keep oils off of any baby, but especially preemies. I'm a dental student where we see mouths in pretty awful condition. One guy came into the emergency clinic with teeth half rotted off from decay and told me he has been putting gummy bears in the holes to make it less sharp on his tongue. That reminds me of the time when I tried to DIY a tooth from a Mentis because I had lost a tooth just before the day where we took school pictures. As a child I got really bad sunburn. The person looking after me coated my sunburn in baby oil to help it heal, and sent me back out into the sun. I realized when I was older why my mum went nuts. I have a Jamie Oliver recipe that directs me to do the same thing midway through roasting a chicken. White bread soaked in milk placed on an armpit abscess to draw out the infection. Needed an IND and a couple weeks of IV antibiotics by the time he got to us. Either that or the guy who crashed his motorbike, scraped his leg all to heck, and then decided the best course of action was to self-cauterize it on the tailpipe. Whoa, stupid or not, the tailpipe guy had a set of brass ones. Dental student here. We had a patient who declined a much needed cleaning, saying he could do it just as well at home with a scalpel. Didn't brush his teeth, but every few weeks he would go at the accumulated plaque and tartar with a scalpel. Same patient also insisted we do a procedure without local anesthetic. He was an amateur boxer and was building up his pain tolerance. He also told us he smoked 20 blunts a day and only drank Coke. We could tell. Worked in pediatrics for a few years and we had this one family come in with a kid who was burned by one of those microwave ramen soups. They put duct tape on the now blistered skin to keep it from popping in the car. Not me, but my mom Had a gentleman walk himself into the ED one day after he tried to give himself a vasectomy with an animal neutering kit he bought on the internet. When she asked him why, he told her that his wife wanted to have a 6th kid and it was too expensive to pay a doctor to do it, and how hard could it be to DIY. That is a man dedicated to not having another kid. So sugar can be used to help heal certain types of wounds. A patient I saw had missed an appointment with part of their care team where they get their bandage changed. I noticed what appeared to be oozing around the edges of the bandage. Asked my patient about it. Offered to change it for them. We didn't typically do that in our clinic. They said yes. I go get fresh bandages and whatnot. Take the old one off and it's just sticky and stringy. Picture the slow-mo shots of caramel being pulled apart. And it smelled. To be fair, most wounds smell, but this was different. I finally asked them what they used to change their bandage since I knew it wasn't discharge. Maple syrup. They used maple syrup. My grandpa thought a leg discrepancy was causing my back pain, which was causing spasms. He put several pieces of cardboard in my shoes to try to even out my legs, which were already even. He also thinks black beans cure everything. My dad thought those pesky spasms was a pinched nerve, so he would take me to the chiropractor, his girlfriend, to get my neck cracked when it happened. Seizures? People, they were seizures. Black beans are delicious and make a beautiful blue dye. That's useful enough for me. I'm hoping you get actual medical care now. Woman I know has a dog that is epileptic but was not willing to medicate the dog for some time. She kept trying holistic remedies. One of which she informed me about was giving the dog all natural vanilla ice cream during a seizure to stop it. You know, because you should always try to put stuff in the mouth of a seizing animal. It didn't work. The dog is on meds. Seizures are controlled now. Imagine that. Had a patient come to the ER for a cough. We did a chest x-ray that caught a little something in the abdomen pelvis. Did a pelvic x-ray. Long story short, she stuck a shot glass up her vagina for birth control, left it up there long enough for it to calcify, and we had to surgically remove it. One time, when I was in nursing school, I was doing a clinical and a guy came in with penile pain. Long story short, several days prior, he decided he wanted a penile texture implant to help enhance pleasure during intercourse for his lady friend. He and his buddy got drunk, of course, and decided to do it themselves. So they went in his garage and took a box cutter to slice open the skin on the dorsal top side of his penis, made some room between the skin and underlying muscle, and put a small porcelain heart underneath. Then he superglued it shut. To make matters worse, the guy didn't wait for it to heal and decided to take it for a test run. He ended up with a major infection and presented several days later. I unfortunately don't know the outcome. I was just there for the porcelain heart extraction. I can't make this crap up. I've now worked in a surgical trauma ICU as an RN for 2 years, and people never cease to amaze me. Putting a toy up the rectum to better reach another, larger toy. I just read the other day about a dude who got a toy stuck up there and then got the kitchen tongs he was using to extract said toy stuck up there too. Adult patient had gas and poked a hole in his belly button with basically a knitting needle to release it. I didn't think it was possible to ever cringe this hard. You've proved me wrong. I'm a doctor, but didn't see this firsthand unfortunately. However, my friend in ED saw a young 17-year-old boy that came in with personal trauma and mild blood loss. She trigged him, taking him to a room with his parents and asked what he'd come in with. His mom turned around and said, "Go on, tell the lady what you did." He then proceeded to tell her that he tried to circumcise himself with scissors for religious reasons as he hadn't been circumcised when he was younger, but had to stop halfway due to pain. Eventually the shame had grown enough that he had to tell his parents, who immediately took him to ED, some antibiotics and a revision by urology later, and he was able to be sent home. What the frick is wrong with people in this thread? My mom once melted Vicks Vapor Rub into my tea because she thought that would help my cold. It didn't. I know people who would do this. More than one of them. They'd swear by Vicks Vapor Rub and kind of treated it like a cure-all. A man who'd accidentally sliced his leg open at his workplace. He obviously figured that as surgeons use staples to close wounds, he'd cut out the trip to hospital and DIY with an ordinary desk stapler. Arrived in ED with a pus-filled wound with the odd discolored staple hanging off it some days later. Not at all DIY, but one of my friend's dad back home was a doctor, and he had a patient come in with 5+ snake bites, mostly on his hands and arms. The patient said he got bit by a snake and tried to catch the snake so he could bring it in for the doctor to identify it. Luckily the snake wasn't venomous. Patient came into the pharmacy and asked if they could use a plastic bag secured with a rubber band instead of condoms. Theoretically, you could. However, it wouldn't work at all and it would hurt. We had a guy come in with an abscess on his right thumb. When I asked him what happened to his hand, he told me about his recent deep sea fishing trip and was given the responsibility of cutting the fish with an open wound in his hand. A sliver of fish got in there and became infected as it healed. So this guy gets the bright idea of doing a little DIY wound drainage by grabbing his pocket knife and cutting it open, leading to a greater infection. You have been visited by the handheld hound of easy transport. Layovers and lost luggage will happen to you, unless you comment travel safe papa.